Thank you for joining us for Memorial Healthcare's Community Conversations. In this weekly video, experts from Memorial Healthcare will answer your questions about how we're caring for our communities during the COVID-19 pandemic, and also update you on new services and offerings at Memorial Healthcare. Our greatest responsibility is the health and safety of our patients, staff, and community. That's why we are committed to keeping you informed and prepared. Today we are joined by Dr. Hassan Nasir from Memorial Healthcare Allergy and Immunology, and also Nick Decker, Director of Memorial Healthcare's laboratory. They will be sharing information with you on COVID-19 testing at Memorial Healthcare and what you need to know as allergy season begins.
PCR testing, which looks for pieces of the virus that causes COVID-19 in the nose, which is part of the respiratory tract, to determine if the person has an active infection. A positive result means that a piece of the virus was detected in the sample, which is typically a sign of an active infection. Antibody testing we also have, which looks in the blood for antibodies against the virus that causes COVID-19 to determine if there was a previous infection. Positive antibody test means that the person being tested was infected with COVID-19 in the past and that their immune system developed antibodies to try and fight it off. The PCR test is a swab of the upper part of the throat, right behind the nose in the nasal sinus cavity. A PCR test can also be done through a nasal wash, where we rinse out the nasal sinus cavity with saline solution and collect these washings to be tested. The antibody test is a simple blood draw, similar to the labs you might get during an annual physical. It is certainly not comfortable, but is not necessarily painful. So the swab is going to actually go back. We actually tip your head back to make access easier. Then we go back a ways and gently roll the swab while we count up to 10. You might tear up a little or feel a tickle or pinching sensation, but after we remove the swab, this usually goes away fairly quickly. We do offer the nasal wash, which works a little bit differently. You're going to go chin to chest, collect the saline solution in a squirt, and then actually collect back into the cup. Test results can be found in the Memorial Healthcare patient portal, or you will receive a call from the provider that ordered the test.
There are many similarities between COVID-19 and allergies, such as stuffy nose, sinus pressure, shortness of breath, coughing, and wheezing, to name a few. However, the differences are that people with COVID-19 tend to have more symptoms related to infection, such as fever, chills, muscle aches, and fatigue. It is important to get tested because while you think you might have allergies, you may have COVID-19 and run the risk of inadvertently transmitting it to your family and the community. Many people may feel like they are suffering from the symptoms of allergies when in fact it could be COVID-19. The PCR testing, which looks for active infection, has an accuracy of greater than 97%. The antibody testing measures a history of exposure to COVID-19 with a greater than 95% accuracy. We are unable to answer that at this time because if the antibody is present, that confirms a history of COVID-19. However, if you do not have antibodies, it does not rule out a previous infection.
Another major focus is to speed up these processes or increase the capacity of specimens we can test at one time to allow for the best access possible for the communities we serve. We are focusing on two distinct areas: the ability to conduct rapid testing and mass testing. Our goal is to be able to have a turnaround time of a few hours for our symptomatic patients ill enough to be admitted to the facility or travel to the emergency room. Mass testing is the ability to conduct an extremely large volume of specimen tests with results available in 24 to 72 hours. We feel these both play an important role in the care model for our community and patients. We currently offer collection of testing at 7 outpatient service centers, and you can reach out, and we do encourage you to reach out to our scheduling center at 989-729-6422. Providing patients with schedules encourages social distancing and keeps everyone safe. Typically, with an order from a provider, insurance leaves the patient with little to no out-of-pocket costs for testing.
Thank you for joining us today. If you have a question for Memorial Healthcare's team of experts, please visit our website at www.memorialhealthcare.org to submit a question. We will do our best to answer these questions on our weekly videos or in one of our frequently asked questions updates. We ask that you visit our website or follow us on our social media platforms to get up-to-date information. Memorial Healthcare. We're here, we're ready, we're keeping you safe.